Well, thank you, Dr. Summers. It was brilliant, as always. Insightful, provocative, but straight to the point. And I think that you've, in many ways, set up this commission's report extremely well. This is how we see the issue as well, and thank you again. I want to welcome all of you. On behalf of the National Academy of Medicine, I'm Victor Dzau, the president of the NAM, formerly known as the Institute of Medicine. Now, you already heard the compelling argument about the issue of Ebola, pandemics, epidemics. And I think it's very clear to all of us that we need a plan that prepares us for the next epidemic, the next pandemic, one that allows us to be timely, to ensure our response is coordinated, based on good planning, but not politics. And we need to develop this plan now before our memories fade or before we lose the attention of the world. So it was in this context that the Commission on the Global Health Risk Framework for the Future was initiated in the spring of 2015. 8 sponsors came together to support the initiative. And I'll mention them in a few minutes. And of course, we, the National Academy of Medicine, provided leadership and guidance for this very important initiative. For those who are not familiar about National Academy of Medicine, let me just say one quick word. That is, under the general national academies, we're one of the 3. National Academy of Sciences, that of Engineering, and of Medicine. The parent organization was in fact established by Congress and Abraham Lincoln in 1863. During the Civil War, and our forefathers had the foresight to say we need an independent advisor to a nation in science. At the NAM or IOM, we were established 45 years ago. We elect 2,000, we have over 2,000 elected members, drawn some of the world's most distinguished leaders in health and related fields. And of course, we're in a unique position to do what we just did, that is to take a critically important issue and to give recommendation based on evidence. So, as you can see, the question about this particular initiative was, in fact, it started back here, sorry. Yes, in the fall of 2014, when Jim Kim, the president of the World Bank, and I had this concerned conversation about what's going on in Ebola. We both expressed serious concern and the need for an independent evaluation recommendation for a new framework that's going to get the world better prepared and being ready to respond. We're so lucky to have Judith Rodin, who immediately jumped in and gave us support. And of course, she is now the co-chair with me of the Oversight Board. And of course, we had the help of Margaret, Jim Kim, and others through a number of series of planning group. And most importantly, or equally importantly, is the support we get from Rockefeller Foundation, from Ford Foundation, from Gates Foundation, Paul Allen Foundation, Mingwei Lau, the Moore Foundation, USAID, and Wellcome Trust. So what is this initiative? This is the architecture. What you see is a commission shown right here, consists of 70 members, some of whom are here today, from 12 countries, 5 continents. It's truly international. What I think is also impressive about this commission is this breadth of expertise, not just in health, but in fact our chair is a famous financier and banker, Peter Sands, but also social researchers, policy experts, industry leaders, and insurance company and community leaders. We have 4 commissioners from the African countries who are affected by Ebola. You're going to hear from one of them today. Now, the oversight group is chaired by myself and Dr. Judith Rodin. And we perform the idea of ongoing guidance, scope of the study, approve the commission slate, commission process, guidelines for review, and assist with developing a disseminating strategy. You see in your you see in your pamphlet and program the names of the commissioner, and I won't have time to go over them. Suffice to say that I'm truly grateful to all of them for the great work they've done. I also mentioned that Dr. Jules Roden and myself oversee the Oversight International Group, which also consists of prominent members of, this is foundation, academia, et cetera, et cetera. Importantly, in order to get this work done, we actually had to take on a short time 4 different work streams covering finance, governance, health systems, and R&D. The Commission held 11 days of public hearing in Washington, Hong Kong, Accra, and London, with the participation of more than 250 experts from various fields, and followed by extensive consultation with experts from the government, industry, civil society, organizations, UN, World Bank, IMF, and WHO. We also were fortunate because by the time we were working through this commission, we can draw on previous reports, such as the WHO Ebola Interim Assessment Panel, as well as, in fact, the London School of Tropical Medicine and Harvard School of Public Health report. And of course, we're in constant touch with, in fact, the UN high-level panel, who's the Secretary of Missions here today. So in that regard, we wanted to think about how to create the most comprehensive report. And so these are the 4 work streams, as you can see: governance, finance, health system, and product. And the Commission brought this together in a synthetic fashion. And I already mentioned to you the very hard work they've done all the way leading up to this report released today. Now, what are the features of this work? I believe we're particularly proud of the fact that this is an independent work, not commissioned by WHO or UN. In fact, the remit, membership, and process of commission were designed to ensure independence from individual governments, international agencies, and other stakeholders. The report is forward-looking because it draws lessons not just from Ebola, but from previous outbreaks such as SARS, MERS, H1N1, HIV and AIDS pandemics to devise the best recommendation going forward. It's comprehensive. You heard that we've consulted over 250 individuals and considered every aspect of the effective framework for preparedness, detection, and response, and it's timely. As Dr. Summers pointed out, it is now. We have to get the world's attention now and not later. So in a short 6 months, which is uncharacteristic of the National Academy's work, we had this thing done, and we're burning the midnight oil. Peter can tell you, even this recent over the vacation and holidays. Finally, as been pointed out by Dr. Roden, it's really important for us to think about dissemination. How do we get this message out there to the decision makers? Today, the New England Journal of Medicine is going to carry a special report on this with the entire 150 pages of the report published online as a supplement of our special report that Peter and I and CC wrote. Importantly, we have many briefings with key leaders in different countries and key leaders in government, in private sector, etc. Key international events, including this, but also many of us will be in Davos, but also there will be a meeting organized by Margaret Chen at WHO Executive Board. And we're launching in Asia, we're launching in Africa, we're planning to do a World Bank IMF spring meeting. We've been closely working with the Japanese Sherpa and their planning group on G7. In fact, Peter and I were in Japan in the G7 working group on the global health issue for Abe and the G7. And of course, we look forward to many other activities which in fact are necessary to move this forward. So with that background, what I'd like to do is to say simply that uniquely about this report are recommendations that are meant to be comprehensive, coherent, costed framework with timelines for specific interventions. So with that, I'd like to say I'm truly, truly grateful to the commissioners, particularly Peter Sands, our chair, and also to our staff for putting this great work. And it's my great pleasure, therefore, to introduce Peter Sands, the chair of our commission. whose leadership can truly be impressive in a very complex issue, and a banker who's learned more public health than many of the people that I know. Peter is a senior fellow at the Mosavar Ramini Center for Business and Government at Harvard Kennedy School. He is also the lead non-executive director of the board of United Kingdom's Department of Health. As you heard prior to this, he was the chief executive of the Standard Chartered Bank, and he graduated from Oxford and holds a master's in public administration from Harvard University. Peter, thank you for your leadership. If I can, may I ask you to come up and give us the report. Thank you.